I've been thinking about how some nurses are like superheroes, especially those in pulmonary
Yeah?
departments.
Superheroes? That's a bold claim. What makes you say that?
Well, I read about this nurse, Katherine D. Larson, who works at
Right.
Bispebjerg Hospital, and she says, "We can do things that not many others can."
That's interesting. But isn't every nurse doing something special?
Sure, but in her department, they handle patients who can, deteriorate in the blink of an
Mm,
eye. They have to act fast and think ahead constantly.
I see. So they're dealing with high stakes situations all the time?
Exactly. For example, one morning she spent almost 2 hours with a patient struggling to breathe. She had to use all sorts of techniques to help them.
Like what? Yeah, what did she do?
Well, she gave medication through masks to open the airways, used inhalations to loosen mucus, and had
Right.
the patient use PEP flutes to keep the airways open. It's like orchestrating a symphony to help someone breathe.
That sounds complex. But don't other departments handle emergencies too?
They do, but she says their patients can crash so quickly that they have to make split-second decisions, often before a doctor arrives. They
Yeah.
need to be highly autonomous.
That's a lot of responsibility. Do they get special training for that?
Yes, new staff receive 3 months of training on all the equipment, and Catherine helps with that as a clinical nurse specialist.
Ah,
They have to master machines that many find intimidating.
but doesn't that put extra pressure on them?
You'd think so, but she doesn't feel more pressured than nurses elsewhere. She believes the intensity is part of nursing in general.
Right.
She focuses on the pride she feels in her work.
It's admirable, but I wonder if it's sustainable long term. Burnout is a real concern.
That's a valid point, but she seems energized by the challenges. The camaraderie with her colleagues helps buffer the stress. She even
Exactly.
returned to this department after working elsewhere because she missed it.
That says a lot about the team environment there.
Definitely. She describes handling a wide range of conditions: acute emergencies, chronic diseases like COPD and asthma, severe infections. No 2 days
Hmm.
are the same.
That variety must keep things interesting but also demanding.
For sure. But she takes pride in the fact that they can do things not many others can. It's like being part of an elite team.
Yeah.
They have to think ahead, sometimes even more than the intensivists who assist them.
Wow, that's impressive. It seems they're really pushing the boundaries of what nurses can do.
Exactly. It's inspiring to see such dedication. It really makes you appreciate the complexity of nursing even more.